So this is the key, isn't it? The coronavirus crisis has seen millions of people shift from working in the office to working from their homes. And a new report shows that before the pandemic, around 6% of employees were working from home, but that shot up to 43% naturally during lockdown in April, meaning around an extra 12 million people had changed their way of working.
Yeah, the figures suggest 7 in 10 workers got just as much done or more work done than they were when they were in the workplace. And 9 out of 10 now want to continue working from home. So are workers being selfish by doing their jobs from the comfort of their home? Well, journalist Sally Jones thinks so. She's joining us now from Warwick. And we can also speak to tech entrepreneur Paris Petgrave. She believes the move to home working has made people happier and more productive. Good morning to you both. So, Sally, 9 in 10 people who have been working from home want to continue working from home. Are you saying they're selfish?
Well, I think they are, really. I think they're really only thinking of themselves, because the trouble is that working from home is great for people like me, for established folk who've got a reasonable house, nice big garden, agreeable place to live. It's fine for the PRs, the city boys, the people who can do everything online. But the ones who it really affects are the young, the people on the high street, things like little newsagents, hairdressers, nail bars, fish and chip shops, you name it. The sort of people that if we're going to an office, which I do for part of my work, but I can just as easily work from home. So I'm part of the problem in a way. But I would love to be going back into the office, even though it's fun to work from home, because those people are losing their jobs in their droves. And I've seen my own hairdresser have a real problem with it, and lots of other small-scale people, but also the young, the people who aren't yet set up in their jobs, because they're the ones who get the message.
Well, let's put that to Paris. That there is a divide here, isn't there? Young people tend to have smaller homes, maybe don't have a garden, and maybe have jobs where they have to go into work. And there are the wealthier people that Sally talks about. They can work from home, and they're being selfish because they're not going in to support the people who are, running restaurants, work on the high street. They're not going in to help them, and that is selfish.
It's absolutely ridiculous to say that. I mean, I have spent more money over the last, 5 months in my local economy, ordering in from Uber Eats, investing in my local coffee shops, going out, and investing in the local economy. So all of the shops and all of the high street footfall businesses in my local area where I live are thriving. If you go into, I was speaking to the owner of the coffee shop earlier, he's saying his sales have increased. Not only that, people, remote working isn't a new thing. We have been heading there for years. Most organisations have remote working. As you said, 6% of people were working remotely before the pandemic. And this is part of the future of work. This is part of the new normal. It has been on the cards for years. We've seen a massive shift in retail industries moving to online. And this has been something that we've been talking about for years, even pre-pandemic. So organisations and businesses in the city need to pivot. They need to change their way of working, to shift their business model, to be able to look at online deliveries. Online delivery industry is booming at the moment. So there are ways of, supporting businesses with footfall, because actually the retail industry is going through transition and it's changing a lot more to online. Now, people who might have a smaller environment or might have a tricky environment working from home, obviously employees need to look at those cases and look at ways in which they can support employees that might not have the right space.
So is it sort of outdated and sort of behind the curve, do you think, Sally, for the government to be launching a campaign this week to get people back to work? Boris Johnson very much in favour of it, in a way from what Paris is saying, that actually Boris Johnson hasn't really recognised that the landscape has now changed forever, and that those people who want flexible working, who want home working, can make it work and are equally productive, and sometimes actually more productive, because they're not worrying about, all the things at home, waiting for deliveries, trying to manage all their things. They can manage their time effectively and give to work as well.
No, I mean, I think that the people who are really going to suffer, and I think Boris Johnson is quite right. Obviously, the work landscape's never going to be quite the same as it was. The ones who are really going to suffer are the young, because there's so much in work that involves actual face-to-face interaction. Obviously, some of the stuff migrates online for the retail, but for the young, I mean, I can remember at the start of my career how much I learned from the hands-on mentoring, the help that I got, being face-to-face with people. There is no substitute
You're
for
right,
that.
actually, because if you think about those little conversations you have, Paris, you know, with an older member of staff or whatever, you might just go, hang on, I'm having a few issues. Can I just ask you about that? You know, all those things that happen are going to go away, aren't they now? Young people won't have anywhere to turn to.
I mean, it's quite, it's a bit patronising to say young people, are not going to be able to do their job correctly because,
or they won't be able to find those friendships with older mentors almost, not officially, but unofficially. We've all had advice from people in lifts and in corridors.
I mean, if the age thing is an issue for you, it's just the idea of collaborating in office, people coming together. That's important because teams work better than individuals.
Teams definitely work better, but you're assuming that team connectivity can't take place digitally or in a different way. I'm not saying that we should totally scrap, meaningful connections face to face, but it doesn't need to look like every single day, 8 a.m. till 6 p.m. in an office, in an environment where public health is at risk. We need to be sensible here. There are mixed messages being told because one minute there are protests in central London and people are being arrested because there's more than 30 people being gathered in an open space. And then on the other breath, the government is pushing people back into the office where tubes are going to be packed and where there's going to be much more than 30 people in a confined space. So what is it? Is there a real risk for public health or not? Yeah. We saw numbers go down because we were working from home. Working from home, as people have spoken, the British public has spoken. A lot of people are much more productive and are happy with their quality of life working from home. The vast majority of the British public and the labour market.
Well, of course, we've got university students going back, and there are concerns that, obviously university towns and cities are local economies in themselves. And there is a real concern that now they will be the new hotbed of where coronavirus cases emerge. Let's just bring in our doctor this morning, Dr. Karan Rajan, who I think is still there. Paris raises a good point there, doesn't she, about where are the health risks in, going back into work, using public transport, there being protests and things like that, versus the sort of mental health aspect of needing to be social, but also needing to be safe. It is a conundrum, isn't it, for lots of people? Where do you stand on it from a medical point of view?
Yeah, I mean, certainly, there are mental health risks from having a degree of social isolation, being at home. Humans are, social creatures. But I think we need to return to some degree of normality. And if people have to have a face-to-face job or some parts of their job require them to be at work, we need to, begin that trend of going back to work. But the most important thing is having the appropriate safeguards at work. So socially distancing desks and, having regular stations with hand sanitizers, masks, ensuring that staff rooms and other sort of enclosed spaces have a limit on the number of people who can be there. And that's what we do in the hospital as well. We've got one-way systems in the canteen, in the doctor's offices. We limit the number of people who can be in one space at a given time. Masks are mandatory in all spaces. So, we do that in the hospital where, obviously there's a lot of people. And if we can ensure those safeguards in the offices as well, and obviously people coming into the offices trying to avoid, peak hours and avoiding the sort of crowded public transport and going to alternative routes.
Dr. Khan, does it seem like a contradiction in what Paris said there, that actually we're not meant to be gathering in large numbers outside, but we're being told that we should go back to the office? Does that seem like a contradiction medically?
It seems like a contradictory, certainly, and I think, from the beginning of this pandemic, there have been constant mixed messages from the government with regards to what exactly the rules are, and I think it's very confusing for the general public what exactly the nuances and intricacies of the rules are regarding bubbles and how you can interact and socialize with people. But I think in terms of workspaces specifically, from my understanding, from a medical point of view, certainly, if there are certain safeguards in place, you've got masks available and you can distance people at work, that mitigates and minimises the risk, similar to anywhere else.
OK, Sally, just a quick point to you. Do you think that for those people who want to carry on working from home, despite sort of efforts to get them back into work, do you think that will affect their standing, if you know what I mean? Will there be comments behind people's backs, do you think? I think that it's already happening. Oh, well, they're having it easy, they're at home today, and things like... I think that, that's another sort of underbelly of working from home, isn't it? That people will be talking about you potentially. Do you think that's a problem?
Yes. I think it is a problem. And the thing is that some people are very easy to get when they're working at home. I mean, I've got a couple of members of my family who are journalists, and quite a lot of people have been saying, oh, well, we can get hold of old so-and-so when we need to, but so-and-so takes the chance to go out golfing or fishing. And I think that that's going to impact on those people, because people will see them as not having quite the same commitment to the job. And of course, as I was saying before, the young are not going to get the mentoring, they're not going to get the help from those more experienced people, or the work experience. I mean, that's terrible, because many of those young rely on work experience to impress the high-ups, maybe get
Sally.
a job.
Thank you so much to Sally and to Paris for joining us this morning, and also to our lovely Dr. Corinne, who's in the show today. Thank you so much to all three of you.